great honor to introduce Samuel Shem, whose work kept most of us alive through medical school and residency and early in practice, who has brought a real critical intelligence to medicine as a whole and the endeavor of medicine in the late 20th and early 21st century, when we saw the professional integrity of what we do stripped away from us often. But Shem's work has let us remember what that's about, remember the importance of relationship itself, has let us develop a critical perspective on what's happened to us. And that's just the medical piece. There's a human piece which is far and goes far beyond that. In books like Mount Misery and the Spirit of the Place, and actually in a book called Fine, which is particularly near and dear to my personal heart, for many reasons, not the least of which is the name, but there are many more important reasons that it's near and dear to my heart. He's really looked at who we are as a people and at what matters in the human endeavor. The Spirit of the Place is a book that's not as widely known as some of the others, but really celebrates not only primary care, but the importance of the relationship and the importance of the relationship in place. These are spectacular books, and Man's Fourth Best Hospital is a sort of return to some of the very early work, but it gives us both a way to laugh at what's going on, but also to figure out or to begin to think about what we've got to do to change it. It's pretty spectacular stuff. And I know many of you have now read Man's Fourth Best Hospital, so why don't I shut up and ask Samuel Shem to say a few words, and then we'll open it up for questions.
You know, I don't know if you can tell on the screen, but I'm blushing. You know, if my mother had talked to me that way, I wouldn't have had to write all these books. Thank you so much. It's been just marvelous to make contact with Michael and to find kindred spirits in you all. I'll take his word for it. I don't know where to start. I'll give you a brief tour a little bit. I never. I was very lucky in that I happened to get a Rhodes Scholarship to Oxford in 1966 after I left Harvard, and I wanted to be a writer, and so I started writing there, and also, you know, under the guise of a PhD in neurophysiology. And in the last year, when I never tried to publish anything, but in the last year, at the end of the last year of the scholarship, I got a notice from my draft board that said, "Come on, you're going to Vietnam." And so I had an easy choice, either Vietnam or Harvard Med. And I thought, rather than killing people or get killed, I would try to save them. So I was I'm 76 years old. I'm living in such gratitude right now, such gratitude. You all know this. Your life depends on a butterfly's wing going one way or the other. I mean, all of us here, we wouldn't be here, right, if it went the wrong way, if it just happened to flicker. So that was something that was really important, or else I would have stayed in England and never gone to medical school probably. And then I had a very conscious choice, or a little. I hear noises in my head, conversations, and the conversation this way was, well, you can go to medical school and make a living, and that way you won't have to write to make a living. And I had the true thought that if I had to live on what I wrote, I'd wind up in Hollywood or some other God place, you know. And so that's what I did. And I kept writing. And at the end of medical school, I loved surgery. I would have been a surgeon, but there are no surgeons that write long novels, so, you know, that last. And I discovered psychiatry. I said, hey, wait a second. You learn about people, you hear stories, and I get mornings off to write. You know, I won't schedule anybody till the afternoon. And that's what I did for 25 years. You know, the irony is going through the house of God and writing that book, you know, never would have happened. I probably would have written crap or something. I don't know. But that was the thing that said to me, it was the first time I had the sense, it's like the divinity just grabbed me at the end of the internship in the Beth Israel Hospital. It said, another voice is in my head, right? It said, this is so bad, somebody has to write about it. This is so unjust that somebody has to write about it. And I guess that somebody is me, right? And I started it just, you know, for catharsis. The interns who were still around, Chuck and Eat My Dust and Hyper Hooper and all of that, we used to sit around and get drunk, and I taped it. And I'll tell you one funny story and then sort of briefly talk about Man's Fourth. I was a playwright in those days, and I was in my psychiatric residency and at McLean Hospital outside of Boston. And I was looking for a play agent. So I asked somebody who's a play agent. I said, oh yeah, there's this play agent in New York. So I sent off a letter. I said, I'm looking for a play agent. P.S. I've got a part of a novel, a medical novel, you know. And I forgot about it. And then one day I'm in the secretary's office in the McLean Hospital, this big mental hospital. And she calls up, and I get on the phone, and this is the first feedback about the house of what would be the house of God. She says, well, I don't do novels, but I read what you sent me of this. I don't do plays, but I read what you sent me about this doctor book, and I think you're either a madman or a genius. And I said, well, I can't help you there, but I'm standing within a big mental institution at this time. So that's how it started. And I can tell a lot of stories about the house of God. But and for any of you who write, it had the worst start any book has ever had. It just was terrible. Everything went wrong. And the other thing that I think, I'm trying to talk about motivation for writing, et cetera. The other thing was, I was a purist kind of. So after it was published, I didn't do any appearances for it. I never did anything for it for 2 years. And people couldn't find me because of my pen name, and it was before the internet. So one day I got a letter from my publisher sent along to me from Tulsa, Oklahoma. And it said, I'm on call all night in a VA hospital in Tulsa. And if it weren't for your book, I'd kill myself. And I went, ugh, you know, that feeling. I mean, put yourself in my place, you know, oh my God, you know. And so from that time on, it came out in 78. 2 years later, in 80, I really decided I had something to say and that I could help doctors, in this case at that time, to get through that horrible internship or residency and maybe even change it. And I think it did eventually have help to have these things changed. So I mentioned all that, and I've been speaking ever since. And the thing I talk about is to deal with injustice, as I just described, and the healing power of good connection, the isolation, the danger of isolation, and the healing power of good connection. I mean, I'm a broken record. I do everything under that banner really, and it's changed, but that's for some reason it really hit me hard. So fast forward, I was happily out of medicine. I did psychiatry, mostly wound up doing 12-step, doing alcoholics and addicts if they went to AA or NA. And by the way, a wonderful thing that nobody really knows about, probably you haven't even heard about this. My wife and I wrote an off-Broadway play called Bill W. and Dr. Bob. I don't know if any of you have heard of that. And in terms of, you know, the work that you're doing, family medicine, I mean, this is really important. It's the best program to deal with those people. And guess what? It was founded, one of the two founders was Dr. Bob Smith, a doctor who when he had one meeting with Bill Wilson, a stockbroker, he said, well, wait a second. If his doctor in New York had Bill's in New York had said, this may be a disease, you know, and Bob says a disease, what, with signs and symptoms, a course, and the progression, what, implying a treatment? So he took whatever, they were both gonna die, and he took what Big Bill said to him and said, we gotta find the treatment. And what they found was the treatment had to be physical, psychological, and spiritual, not religious. And that was the beginning of the holistic movement in 1934 in Akron. Anyway, you can get it on Amazon. It's a wonderful film of the play in the Off-Broadway theater. But let's go fast forward to, well, actually, oh my God, 6 years ago maybe, out of the blue. Well, first as I think I mentioned that Harvard hated me for the book. Maybe I didn't, but they did. They did awful things. They did some really nasty things. I didn't care. I knew I'd written the truth with a little humor and a lot of sex. And so I got a call from NYU Med out of the blue, and the dean said, how would you like to be a professor in medical humanities at NYU? And I said, well, why would I want to do that? What do you want me to do? And he said, we want you to teach. And I said, what do you want me to teach? They wanted me to teach the house of God. And this was a shock. And so I said yes, and I joined them. And I quickly saw that they were, even though it's 47,000 people, it's a very kind system. It's a service-oriented system. I mean, Bellevue is the obvious big service thing. And I'm wondering, why does everybody kind of feel better working here than they ever did at Harvard? You know? And I realized after a while, the top 3 people who run the place were interns and residents at the House of God when I was there. And they were abused, and they weren't going to abuse others, you know, down the line, right? It kind of blew my mind. That's why they called me. One of them was in my internship class. So I always wanted to write a real sequel to the House of God. But I was out of medicine. I was writing other things. Well, writing medicine, but doing a lot of other things. And the first time I was on the wards at NYU, not Bellevue, but the other hospital, I brought an absolutely fresh eye to medicine, right? It was clear-eyed. I didn't know much about it anymore. And I saw 2 things that gave me that, hey, wait a second moment. And we can turn, this is what we will wind up talking about, I'm sure. As Roy says, the hero of the House of God, Roy Bash, is the character again. And he says, I'm called to write this story because it was a time when medicine could go in one of 2 ways, either toward more humane care or toward money and screens, which means money and money, because as we all know, of course, the computers are basically billing machines, right? And so I got that thing, hey, this is so awful, somebody's got to write about it, and I guess it was me. So that's what I did. I almost killed myself, you know, really passionately writing. And the result is about as good as I can do. I think I think I probably could make it better, but I think I took it as far as I could at that time, a couple of years ago now, probably. And the book is very simple. It had a simple premise, which is that man's fourth best hospital had plummeted from man's best hospital. Those of you who know Boston may have and it's also trapped under a huge, you know, conglomerate medical system called buddies, right? That's squeezing the death out of them and other hospitals. So they fall from number 1 to number 4, and it's a very waspy hospital. So the board got very nervous, and one of them was even said to be depressed. You know, that's unusual for a WASP. So so they're in trouble in terms of prestige and money. The fat man out on the West Coast, first in Battle Runs of the Stars, and now in Silicon Valley, finding a drug to prevent memory loss in Gomers, is rich as well. And so through contracts, they say, come join us. You can do whatever you want to do. And what he wants to do, and what I wanted to do as author, right, given the way things were that I saw, what he wanted to do is establish a public clinic just next to one of the big buildings in man's fourth best hospital. They want to get it back up to number 1. And he rounds up the usual guys that were in the house of God. And he said, I want this clinic to be an example of how to put the human back into medicine, how to put the human back into medicine. So that's the book. I'm sorry I talked longer than I should have, but that's the book. And the horror for the House of God, as I said, was the brutality of medical training. The horror for this one is the system, is everything, is the system. And so I took that challenge to, first of all, understand the system. And the fat man gives a lecture midway through the book called The 6 Rackets of American Healthcare, Follow the Money, you know, and then he tells what to do about it. So that was my job, and, you know, you can judge how I did it. So
maybe we can would you mind taking some questions?
Oh no, that's the whole point.
You know, Wayne Jonas brought the book up in an earlier discussion. Wayne has been the sort of prophet of integrative medicine in the United States. You know, he has taken the thinking you did about the spiritual and combining it with the physical and the emotional, and tried to raise it to a new art form. So Wayne, I don't know if you want to start with a couple of questions or two.
Well, thank you, Michael. I appreciate it, and great to.
Hi, Wayne.
Hi, how are you doing? Yeah, I was in the car when we started. I couldn't have my video or audio on, but I'm at home now, so I can stick it on. Plus, I was actually on another Zoom it's about to finish on my other computer. Speaking of technology, that is all about group visits. Mm-hmm. And it's run by an amazing guy who called Jeff Geller, who started group medical visits because he saw that one of the main problems that he had in practice was loneliness. Uh-huh. And that was what he was trying to solve, rather than, you know, solving diabetes or a hypertension group or a chronic pain group, although he does all of that and all those groups work, but his primary thing was loneliness. And it was fascinating because he showed significant lowered costs, improved outcomes across the board in chronic illnesses, you know, improved quality of life, well-being, et cetera, by just bringing people together, letting them share, talk, connect, et cetera, and then just saying, hey, how can we get better? And what should we do? And making games out of it. And now he runs a group medical visit training center. I mention that is because he's in Lawrence, Massachusetts, just north of Boston,
Yeah.
one of the poorest areas of the state.
Yes.
And he was doing this just, you know, an hour or so drive from Harvard. And I was sitting at a big medical conference at Harvard, and they were talking about costs and outcomes and all that kind of stuff. And right around them were solutions to their issues, non-technical solutions, exactly about what you just described, which is that you know, it's about relationships, stupid.
Yeah.
Okay.
Yeah.
And it's about people and human beings. And so when I saw the title of your new book, Man's Fourth Best, I laughed immediately from the title because I knew exactly what you were trying to do there. I loved the book until you killed fats. So my first question, I have another perhaps different question later, but my first question is, why did you do that? That destroyed me.
Oh, I'm sorry.
And, you know, it's all right. I love the book, but at the end it was a shocker, which I just, those kinds of things, that makes for good writing. So I'm an aspiring author myself. Michael's mention of my book, How Healing Works, is very complimentary. It's not selling all that well, except to people who understand primary care, and they love it.
What's the name of it?
It's called How Healing Works.
Yeah.
And it's basically stories about how patients have taught me about how healing works, which is 80% has nothing to do with what I learned in medical school. And nothing to do with what I'm, you know, told I should be doing through, you know, the SOAP note over and over again. And that's now structured into the electronic medical record, so you can't escape it, right? And so I teach something in it and describe why in that book, something called the HOPE note, healing-oriented practices and environment. And it's simply changing the dialogue with patients to know what's important to them, and then using that as a way to engage them in their own, engaging their own underlying determinants of health, and then just helping them go through that healing journey. And that's all it is, really. But it is so profoundly different than what we do in medicine, and the economics of medicine is driving us away from that.
Yeah.
In this area. That was so my first question is, why did you kill fats? My second question is about the medical economics, but I'll wait on that one. We'll probably get to that in a bit. So thank you for writing the book. I really enjoyed it.
Yeah, you should send me a copy of your book, okay?
I will be happy to do that.
Yeah, Michael has my address, I think. Yeah.
Great, happy to do that. Thank you.
Yeah. Well, you know, fiction writers, well, I'll talk about myself. As a fiction writer, I don't have control over all of that, you know. Well, I don't know, maybe I was a little obsessed with death at that time, because the book begins with Roy falling off a mountain, as you know.
Yeah.
How many of you guys have read this? Most of them? Or, oh, great, good. I want to hear from the medical student or your next.
Yeah.
We now have 2 medical students who have joined.
Oh,
we have a second
great.
medical student, Brian Kazuba.
Oh, great, good. I don't know that I see him, but all right. The fall off the mountain that almost kills, you know, another inch or so, he'd be dead, happened to me. And I was considering, we have a place in Costa Rica, and I was, you know, and so I was starting the book, and for better or worse, feeling very mortal. And so in the first chapter, you probably didn't even notice it. Roy says because he's thinking about his own almost death, he says, and I'm thinking about fats. I don't know if you remember that, but in the first chapter, he mentions that the fat man is dead. And when I was writing the book, I knew he was going to die, but I didn't know how or when, really. And what can I tell you? I think you can look at it as it was right in a lot of ways for me. I mean, you can look at it where, if you remember, he's all dressed up in a suit, ready to go up to the top of this building and probably be offered the president, to be the chief of medicine or whatever of the whole place, right? I think that, yeah, that's, no, I think
Yeah.
the president actually.
No, yeah, he's going to run the place. Yeah.
He's going to run the place. And, so he is starting to buy into that stuff.
Mhm.
Right? He probably would have taken the job. And I could not see him, doing that job, I guess. And so that, it seemed like he's going to get it. He's not going to survive.
Yeah.
I miss him. I'm really guilty, actually. I'm very guilty. I mean, I keep thinking maybe that didn't have to happen in that way.
No.
But I plead.
Well, I interpreted it as humanism is dead, and certainly family medicine, which is certainly trying to be as human and started off being human as the core aspect, taking care of the whole person, and it's dying. It's dying. Primary care is dying. It's diminishing. Students, except for the couple that are on this call, aren't going into it. It can't financially survive. COVID has cut its knees off. Okay. I mean, and so the relationship issue is continuing to struggle and perhaps is dead. Who knows? Anyway, that's how I interpreted it. But
well, yeah. I also, if you notice, there are a lot of guns in this book, in various different ways. Patching up people in emergencies and all this stuff. And as a novelist who wants to talk about the bigger things about the country, about the environment, I have to write, write about guns.
Yeah, sure. Yeah.
Anyway, I'm sorry. I feel bad every day now. I don't know how long.
No. I mean, it was powerful. It was very powerful.
Well,
so
let me just
in
the defense of the book, I think that loss, the last two chapters then after that are about how you deal with somebody you love who dies. And I think that's really important, in all the different ways, And then at the end, I think there's quite a lot of hope in what goes on in the last chapter. I hope you felt that too.
I did.
Yeah.
I did. No, thank you. Appreciate it. I have one other question, but I'm going to let other people
good.
share here. If we get time, we'll go back to it.
Okay, thank you. Thank you. You're doing wonderful work.
Steve, I just wondered, since we're talking about the fat man, was there a person who actually was a model for you or an example? He's such an extraordinary personality and extraordinary image.
I'm sorry, this broke up a little bit at the beginning. So
I was wondering if you had a friend or a colleague who actually was your model for the fat man.
Oh yeah. Yeah, did I have a friend or a colleague who was the model for the fat man? Well, there are lots of, I think they've sort of gone away now, but there are a lot of people who claim to be the fat man. After the book came out, they were cited all over the world. Iowa, there was a big one in Iowa who kept on claiming it. There's somebody in Australia who's the fat man, And I've gotten to think that, well, there was no fat man. If I'd had a fat man, I wouldn't have had to write the book. I had a better time of it probably. I didn't know this exactly, but because you can't write novels consciously, really. Well, totally. I think it's very clear to me that I am Roy in a certain way, and then I am the fat man in a certain way. And I behaved both ways in my internship, and they kind of were okay with Roy for most of it, but they weren't okay with when I acted like the fat man. So he was, I don't know where he came from, but God bless him. I'm so glad he did. What a character,
Yeah, exactly.
And I used to be fat when I was a kid. I think that was the.
And the same question about Barry, who is just too good to be true. Most of both books, but hopefully you know and have lived with someone who was your model for Barry.
Well, that's an easy one. She's my wife.
Congratulations.
Yeah. the Roy figure has a lot of autobiographical.
Sure.
It's made up mostly of me, I think, Roy, and much of what how she just described in the House of God was based on real things, especially if you go and look back, which is the most searing thing of a lot of searing things there. Only one time does she go into the hospital, watch what's going on in this craziness, and it's an incredible scene, I must say. Looking back, it gets me chills, you know, because she winds up saying, "No, you can't do this. Do you think?" Or Fats says, "Do you think that that parents want to hear what their teachers say about their children? No, you can't." But we didn't say it to anybody except ourselves. So yeah, long story short, it took us a long time, and we've been together for a very, very long time, and have a wonderful adopted Chinese born girl who's 28 now. But yeah, she's amazing. I just have to say, now she's a Buddhist teacher.
Huh.
I mean, it's unbelievable.
Yeah.
Books this thick on the sutras, you know, little type in bed. She's great. She's really great, I must say. I would be nowhere without her. We were apart for a long time and then came back together.
Allie.
How about a med student? Oh no, I'm sorry, Michael.
No, I was asking the same thing, whether Allie or Brian, the med students, have a question or comment.
I just want to say it's an honor to be here with everyone and with you. I was actually able to read your book back in February. I took a month and did a literature and medicine elective for 4 weeks.
Oh, where?
Just here at Albany Med. They offer 4-credit literature and medicine where you read like 6 books and write a 20-page paper over the course of the month.
Yeah.
And I tried to read your book before medical school, and it was horrifying, and I couldn't.
The House of God you're talking about?
Yes.
Okay.
Yes. And so I couldn't get through a few chapters, and then 4th year of medical school, I was reading it and I identified a lot with what was going on.
Yeah.
And
said,
I
oh God, it's true.
Yeah. I talked to several of my classmates about this, and they all had the same story that I had.
Yeah.
We all tried to read it before coming to medical school, and then 4 years later, we read it and could understand better.
Yeah.
So even though it was written, you know, a few decades ago, I feel like the same themes run true still today. So, and I still need to read The Fourth Best Hospital, but I'm excited to read it.
Good. Yeah, I hear that all the time, that people can't read it. I just, as I say, I'm the luckiest guy alive in terms of that. You know, it just sells more than ever now. It's just, as I said, I had the same experience, but on the other side as the teacher, because in the at NYU in the symposium, it's, you know, it's mostly for medical students and others too, but it's an hour and a half session, 90 minutes, 6 of them, and we just go through the book. And they're all different. They're usually first, second year that come, they have more time. And I didn't know if it would work, but it is riveting. It's riveting. It's unbelievable. This is a very important statistic. In 6 years of treating this, teaching this, no one has ever gotten up and gone to the bathroom in a 90-minute seminar. Isn't that amazing? I mean, it's amazing. So it does reverberate, you know. And I would hope that that Man's Fourth Best Hospital, which is different because the time is different, I hope that'll reverberate too. I think it will. Yeah. Who knows? I won't be around to see probably. But thank you very much. I must say, though,
it will.
I must say though, I finally got, well, no, I won't. This is about a review. I'm not going to go there. Let's who's next?
Brian, you want to take a shot? Looks like Brian, no, he's not frozen.
Oh, can you hear me?
Yes.
I can hear you now.
Oh, okay. I'm sorry. I had a crazy situation where the power completely went out with a storm, and then there was a police officer driving around with lights. So I really apologize for coming in late.
It's okay.
And I think, you know, the whole nature of the book and what it resonates by, it's just something
Brian, you're breaking up very badly.
that you see
I couldn't
every
hear.
day, and just, you know, the whole explorers. So, can you hear me? Hello?
No, we can't. We say,
Brian,
it says, yeah,
It might be.
Brian, you may do better turning off your video and just keeping your audio, and it may give you a little bit more bandwidth.
Let's see. Can you guys hear me better now?
Yes.
yes.
Yes. Okay. So I just apologize because there's no internet. There's poor cell service. Like everything is completely out here. But I could hear what you guys are saying, and you know, I just wanted to say that everything, like with the book, it's, you know, the whole nature of how, you know, the problems that you see in today's world, it really resonates, and kind of being on the floors and, you know, seeing all these things, it's just something, you know, because you see how it affects patients, how it affects the people working in the hospitals. And I think, Larry, when we were at the SMEC conference, you made like a great comment about how art and is like the future of medicine and how important it is for us. And so, you know, with books, with people writing and imagery and different things, it's like how we get a message across. And then the other part, when you guys mentioned about like primary care dying or that family medicine dying, it's almost like at the same time it feels like this is when we most need it. And so I'm just like thinking about, you know, it's just like we're in this, especially now with the COVID world and everything, it's like primary care really needs to be there. So definitely, and I really appreciate this opportunity, and thank you so much. And again, I so much apologize for this horrible situation with the power and everything.
Where are you in medical school?
So I'm in Albany Medical College.
Both of you
and
are.
I live on a different side of town than where Allie lives. So this area is completely out of power.
They're both fourth year. They're both fourth year students.
Uh-huh. Well, you know, I grew up, if you can believe it, in Hudson, New York, which you probably know. And Albany was the big town from down there in Hudson.
Mm-hmm.
And anyway, it's I've never spoken at Albany, actually, of all these places. Usually I've been, yeah.
So I want to make a comment while we have time. So I was the behavioral person, the social worker in Penn State University's Department of Family and Community Medicine. I started there in 1978. And for 13 years, I ran the resident support group. It was for the first year residents. We took away their pagers, and they spent an hour to an hour and a half during a lunch period on every Wednesday. It was required attendance. And every July, of course, there's a new group coming in. It was a 666 program. And they all came in without saying it. After a number of years, I learned they all came in with a sense of denial. The system's not going to take me down. I'm going to just run harder, run faster. I'm going to dodge. I'm going to duck. I'm not going to let it get to me. And my message, I had, after all those years, I had standard messages for them. First of all, I required them to read the House of God. And in the month of July, they read that. And it helped to break through some of the denial because they needed to learn how to be able to be upfront with each other so that they could nurture and support and help each other out. We lived through one resident suicide who was a long story, but that sense of cohesion in that group. But they all came in thinking it's not going to happen to me. After they read the House of God, they thought, well, maybe. And by February, and I told them this, I said, you may think you're going to run through it now, but I guarantee you by January or February, you're all going to be on your knees and you're going to need each other, and you need to be honest with yourself and with the group here so that you can get the kind of support that you need. But your book was an essential piece to that, chipping away at the initial, I just called it denial.
Yeah, I'm aware of time. I just would say that in man's fourth best hospital, the real issue is connection, is really how you maintain, connection, good connection in a terrible system. And it has gotten terrible in some ways now. And I think, all in all, it's probably going to get worse now. And so the main thing I say when I talk about it is the connection comes first. And I give the example that you will all realize is that in medicine, if you're seeing a new patient and you connect, you'll hear everything. If you're seeing a new patient and you don't connect, you won't hear anything. So connection comes first. And the other thing that I talk a little bit about is how that nobody gets it right in relationships, whatever they are, at home or in work or stuff. You're always coming to a disconnect. And the people who survive and doctors who are really great, they make those mistakes, but then you hold the idea of a we with the patient through the disconnect, and it's a better connection, right? The difficulty helps to make it stronger if you can hang in. And actually, I'm a product of the 60s, and it reminds me of what we're going through now here in this country is horrific. It's as bad as it was in the 60s, although the fires weren't in all the cities, and there weren't all these assassinations. But what I think is going to happen, and I hope in medicine too, is that everything is so, it had to get this bad to change. This is what brings change. This. And you're seeing little twinkles of it now, with what we're seeing on the TV. But this is how change happens. And I just want to, do we have to stop exactly in 4 minutes, or what are we doing?
No, we don't have, we have no hard stop.
Okay, except everybody's taping the debate, I presume, with Kamala, I really feel that I want to say two things to this group. Before I forget, I would love to be a participant in this group. It's exactly what we need. However you can use me, and I'm offering that. I don't know what that means. Maybe I'll sell some more books. I mean, the book was going very well, Man's Fourth Best Hospital. Then all of a sudden, two things happened. One, and about the same time, first week in March, really. One was the corona came in, and all of my publicity stopped. Nothing, zero, all the way out toward January. So, and the second thing is I caught it. I caught the virus when I was in New York on March 7th at two big hospitals, Montefiore and SUNY Brooklyn downstate, you know. But I would be very glad to try to help you, or be, I don't know what that means, because what the fat man gets to in Man's Fourth Best Hospital, and those of you who read it know it. He has ideas about what to do about it. The simplest one, as he says, is you got to squeeze the money out of the machines. You got to squeeze the money out of the machines. And I can elaborate on this, but I mean, I think we docs would be fine if, like the VA, basically, if we just typed in our diagnosis and treatment, right? Who has a set, basically, you know, all over the country about the same reimbursement. And then you look and you see, oh, does Michael Fine in fact have a private insurance? Oh, he does. Good. One more click, you send the data to that insurance and they take care of it. You want more money, you use your computer. Stay the fuck off of our computers. Imagine what that would mean. Imagine. It's not unheard of to try to do something like that. But I think the other thing that the fat man talks about, which is, of course, as I say, I put forth this difficult situation in as much verity as I could. And so I said, okay, I can't leave people with that. I've got to, you know, what would the fat man say about this? And one of the big things he says is alliances. That we doctors, the only thing's going to work, and it's a long shot to work this way. We doctors have to ally, certainly with other doctors and other people in the healthcare fields, but doctors, nurses, other people, even patients. You know, that's the way things change. That's the way things change. Just, you know, I like to give the example at a big theater, if somebody falls down, do you hear a cry go out? Is there an insurance executive in the house? No, we do the work. We're the workers. I go crazy when I think about this. Nurses have got a terrific union, and they almost never lose an action that they take. I'll give you one little thing that happened last year here in Boston. They wanted to, you know, have more nurses, more coverage. Basically, I think was the idea. At the Brigham Hospital, and they worked on it for almost a year. Nothing was going. Brigham was hard-ass. They went to the last Sunday before the Monday they were all going to go on strike, and the mayor came in, and he settled it. Okay, good. 3 days later, in the Boston Globe, top right-hand story, Brigham loses $24 million that it had to plan for the strike, that they'd already spent $24 million. So, I mean, I don't know. I mean, we can take our power. We can take our power, I think.
And I think Wayne's got a question.
Yeah, Wayne.
I do, and I sorry, I know that we're coming up on the hour, and the debate is starting, which may have something to do with the future of our whole democracy, frankly. But so there was a section in Man's Fourth Best where the group gets together and they describe the money flow. And then there is some suggestions about the solution. They have to go see patients, and they don't quite get to the solution, but they actually get a couple suggestions. But the money flow model that you described there, did you have a consultant on that, or is that just something you just know about? I'll tell you the reason I'm asking. I don't run a foundation. I oversee the health funding from a foundation. And Michael, pardon me, I need to email you and have a specific discussion with you about this too. But we're in discussions with the National Academy of Medicine to talk about transforming, in the light of COVID, the fee-for-service process to a global financing system, like the VA. And they're serious about it. They want to move forward. We're really trying to make sure it's focused. You know, the NAM can go off on all kinds of tangents, as you know. And so when you were describing sort of the layers of the money flow, I was thinking this is something that might help the multiple stakeholders that are in this, from insurance to, the healthcare system, to the owners of the healthcare systems, to the providers, to the patients, to begin to have a common language about this and begin to understand sort of common models. And we want to try to take them to a model of the future that will actually create a health in people as people and populations, whole populations. What kind of a financing model would drive that? And so I just wanted to know, did you have somebody who helped you with that? Or was it just you? Where did that come from?
Well, yeah, as I said, I felt it was my responsibility to be able to do that in this book. I'm talking about the system. I got to be able to do that. And I do it with humor in a way. And,
Yeah.
I think it's the
That's
fat
great.
man's talk you're talking about, where he gets
Well,
chalk,
and they get
chalk
they get go ahead. No, I'm sorry. Yeah.
on the chalkboard with chalk, I think. The six rackets of American healthcare follow them.
Exactly. Yeah.
Yeah, I just
Mhm.
mentioned that, I think, before you got in. No consultants. I read a lot, and I have a lot of contacts that I talk to. Actually, one of them is lovely Dr. Mark Vonnegut, who you might want to even have on or something, who's a pediatrician in outside of Boston, a wonderful guy. He's going to come out with a nonfiction book in a year or so. But no, look, it took me to write that thing. It took me 3 months of study, of real hard study, to do it. And I think it's pretty solid, I just want to say, and this is not as self-serving as it may seem, I would love to be part of helping what you're doing with this. I had this grandiose thing after I finished Mansforth. I wanted to try to get it into the discussion for the election,
Yeah.
and I tried. I didn't have the contact text, but I'm a 60s guy. Things can change. We did make it better for a while. We really did.
Yeah. Yeah.
And I'm very serious. If I can be of any use to you in being in touch with them and being a resource for them, and this isn't quite what an author should say, but have them buy the book.
Yeah.
Because it's not just a funny book, or every
Yeah.
fucking word in that is about how, from patients to nurses to, it's about trying to make this better. I'm passionate about this. I really am. I mean, I have not been hurt by the system. I got out, and so but I have now seen. I've been all over the country. I know all about these things. I have now seen the system clear as day because I wasn't in it, and
Yeah.
I want to get something going. I want to help, and whether that
Well,
means
thank you.
doing something with the book or being on these, I don't know. I'm a terrible organizer, and luckily the House of God organized itself. So
Yeah, no, that's
I think-
great. Do you have a picture of the chalkboard? Okay.
What's that? Yeah.
Do you have a picture of the chalkboard?
Yeah, chalkboard. I just want to ask, and this is immodest, do you think that we could use this book in the way that I wanted to use it, not just as a book, but as a primer on, what's the situation now and what are some starts at this, just to people have it, use it,
Yeah. I'll definitely think about that. And there's no question. I mean, reading it and then hearing you and your interest and everything will definitely get me thinking about, can we sort of insert that into a change process that is going? And I'm sure Michael has probably lots of ideas about how to do that too. So
yeah, not only insert in that, but me.
Got it.
I want to be involved.
Even more important. Stan, and I think you've got to be our last question.
Okay, so my comment here, and I think everybody on the call has been involved in multiple ways. I think the opportunity is to form alliances in many, many different ways. My last full-time job was with the American Academy of Family Physicians. And what I see is that big medicine organizations are part of the establishment, as well as, so they can be part of the solution, but they could also be part of the problem.
Right.
And so I think that, as Wayne mentioned early, rank and file docs in practice in the community, they're the ones who are suffering here. And I think if there's a way to connect, through them, with them, to get the messages to them, I think, as you said, they have the power. We all have the power. But, everybody's out there fighting battles oftentimes by themselves. And so I think whatever efforts moving forward, it has to be, and both. It needs to be grassroots and, National Academy of Medicine. It's got to really be on multiple levels if we're going to organize people to really bring about change.
Yeah.
So not a question so much as a comment.
And we all know that doctors are really suffering more now because of this. Even the ones that are making a lot of money. Let's not forget that. But the other thing is, if anybody wants to get to me, it's shem@comcast.net, right? I'd be glad to talk to you.
And then Larry, if I know you, you're going to pick this up and run with it. So I suspect this group of people, and perhaps even a larger group of people, will be able to meet again soon.
Good.
Larry, is that a fair pitch? All right. Samuel Shem, I don't know how to say thank you enough for taking the time, and also for sort of your moral imagination, which sustained us and tonight still sets us free.
Thank you. Thank you.
Yes.
Thank
you very much.
You're
Appreciate it. It was great.
Thank you.
It was great.
You
Thank you,
guys,
Michael, for organizing it too.
we'll be in touch.
Good night, all.
Bye-bye.
Night, everybody.